Good morning. My name is Pat McGinnis, and I'm the Executive Director of California Advocates for Nursing Home Reform. Tony Chicotel, our staff attorney, will be facilitating the meeting, and he will be introducing the speakers in a bit. We are here today not because we want to open up nursing homes to any and all, but because we're asking the state to allow for at least a designated visitor program, i.e. to allow at least one visitor designated by the resident to visit. With appropriate PPE, with testing, social distancing, these restrictions can and should be lifted to allow a family member to visit a loved one in a nursing home. For those who can visit outside, that is an appropriate option as well. But until recently, this too has been denied. In mid-March, when the pandemic emergency was declared in California, one of the first directives to nursing homes in California and across the country from the Department of Public Health was to ban all visitors. Family, friends, long-term care ombudsman, even the department's own nurse evaluators were prohibited from visiting. Residents' rights and most regulations were suspended, including staffing requirements. This left California's 100,000 plus nursing home residents totally at the mercy of understaffed, unregulated facilities with no PPE, no testing, and overworked and underpaid nurses' aides. Most nursing home residents are crowded into 2-3 bedrooms with no opportunity for social distancing anyway. No one to complain to, since complaints were not being investigated either. Is it any wonder then that nearly 45% of the people who have died from COVID-19 are nursing home residents? Here we are now, nearly 4 months later, and still nursing home residents are not permitted to see a family member. This isolation has led to preventable deaths, higher morbidity and mortality, and emotional devastation among residents and family members alike. Continuing to leave nursing home residents to get infected, to suffer, and to die alone is not a civilized option. And that's why we're here today. And I'll turn it over to Tony Chicotel, CANHR staff attorney. I ask you also to put your stuff on mute so that we don't hear the background sounds.
Yeah, hi. Thank you, Pat. Good morning, everybody. Before I read some prepared remarks, I want to introduce the speakers after myself. First of all, I want to thank the members of the media for joining us today. I want to thank Lori from Consumer Voice, who will speak after me. She's the Executive Director of the Consumer Voice for Quality Long-Term Care, which is based in Washington, D.C. and covers long-term care issues throughout the country. After that, we'll hear from some family members who have been heavily impacted by the visitation ban in California, particularly Raquel Rivera, whose sister lives in a distinct park nursing home in San Francisco, Jay Cox, whose mother passed away in a nursing home in the San Diego area, and Betty Nordwind, whose mother is in an assisted living facility in Los Angeles. As Pat mentioned, the visitation of residents is not just something that we think is a pretty good idea. It's codified in federal and state law. It's a protected right, a very important, one of the most important rights that residents of long-term care facilities have. The visitation ban has been the most massive civil rights deprivation in the 70-year history of the modern nursing home. I think it's important and essential that we understand this as a massive civil rights deprivation. I don't really read about that much in the newspapers these days. Our basic argument, as Pat really mentioned, is the benefit of support person visitors is greater than the costs. It's really that simple. There are it's greater than the cost of prohibiting visitors. There's really 4 conceptual problems with the visitation ban. The first is the length of time. When the ban was first instituted, it was done in a very hurried way. I don't think that we ever thought at the time that this was going to last months or even possibly years. So it was very quickly done. There's no mention of the possibility of outdoor visits, which really seems like an anachronism today. We're all sort of used to now venturing outside and socially distancing ourselves and protecting ourselves in that way. For the first few days, this was a separation. As it turned to weeks, it became more about isolation. And now that we're entering our 4th month of this, it's really become inhumane and cruel. The second conceptual problem with this is that it institutionalizes ageism and paternalism. As a society, we're used to making decisions for long-term care residents about them, but without them. This was adopted for their safety, but without a single consultation with residents or their advocates or their loved ones. There was no due process, there was no public debate, there's no studies, there's no evidence, there's no deliberation. It was just blanketly imposed, and we cast about 2 million of our most vulnerable residents into solitary confinement-like conditions. The third problem is that we've overestimated the efficacy of the ban. The ban was done with the idea that we would prevent the infection from entering long-term care facilities. Well, in that regard, it's been a colossal failure. Over half the nursing homes in the country have had a COVID-19 outbreak at this point, and many, many assisted living facilities as well. The staff, it turns out, were the weak point in bringing the infection into the facility. But families continue to be the ones who are singled out and completely prohibited from entering the facilities. The fourth problem is that we underestimated the importance, the essentialness of family visitors. Support person visitors are not supplemental to long-term care provision. They are essential, especially at a time when facilities are in turmoil, with a lot of flux in the staff. The governments have waived the training requirements for staff. So we've got a lot of new staff people who don't really know what they're doing very well, who don't know these residents, and the people who know them best are being left out of the discussion. So in conclusion, visitors do increase the risk of transmission of COVID-19. There's just no way around that. And we do need to be careful about how and who enters the building. But we are now at the point where the costs of the ban far exceed the benefits. So I will now turn over this discussion to Lori Smetanka, who's the Executive Director of the Consumer Voice.
Thanks so much, Tony and Pat, and thanks for inviting me to be with you today. As Tony mentioned, I'm the Executive Director of the National Consumer Voice for Quality Long-Term Care. We are a national advocacy organization. We advocate with and on behalf of individuals receiving long-term care and services by promoting quality care, quality of life, and the protection of rights. This year, we're happy to be celebrating our 45th anniversary of advocacy. The visitation ban in long-term care facilities, which as you've heard is in place for more than 100 days right now, has been a really extreme hardship for residents and their families. It's become the top issue we've been hearing concerns and complaints about across the country. While it's hard on all of us to experience missed birthdays, Mother's and Father's Days, being unable to see each other in person, to hold each other's hands or give hugs, the ban has been extremely traumatic for residents of long-term care and nursing homes, resulting in significant physical and psychosocial decline and sometimes even death. Some long-term care residents have become so distraught by the separation from their loved ones that they've stopped eating or are unable to get out of bed, giving up even the will to live in some cases. Families have shared stories with us of loved ones living with dementia whose symptoms have intensified, and residents with behavioral health needs whose needs have worsened as a result of not having their family members nearby, helping to manage their anxiety and their distress. And tragically, we've heard too many stories of residents at the end of their life dying alone without comfort or presence of family. There is an exception to the visitation ban for compassionate care that's been allowed by federal and state governments, but unfortunately this term has been ill-defined and has been arbitrarily implemented across the country, so we don't find it to be useful. Even newly released guidance in this area has been insufficient. It doesn't provide clarity on when compassionate care visits should be permitted, nor does it focus on the specific needs of the resident and establishing what compassionate care policy should look like. As advocates for residents of long-term care facilities, we're calling on state and federal agencies to develop universal protocols that balance necessary infection prevention and control measures to protect residents and staff, and balance that with the needs and rights of residents to connect with family members. We're also calling on them to permit every long-term care resident to designate an essential support visitor who will be permitted to visit on-site following the same screening and infection control protocols as the staff. Visitation for essential support persons needs to be established in a way that's person-centered, meaning that it's based on the specific needs of each resident, not based on arbitrary guidelines, and it needs to enhance the well-being of the resident. Reasonable accommodations for visitation need to include ample daily visitation hours and privacy for residents and visitors, and priority in visitation should be given to those needing compassionate care or at the end of their life. The reality of the crisis is that we're likely at least many months away from full visitation in long-term care facilities, and many residents cannot wait for us to allow people back in. They need their family members with them. We have a moral obligation to employ sensible practices that provide critical social connection and to support residents. Connection matters as much as protecting residents and staff from the virus. Thanks for having me today, and I'm happy to answer questions when we get to that point.
Thank you, Lori. Before I introduce Raquel, I want to mention that CANHR has put together a June 30th day of action for family members, residents, resident advocates to all reach out to policymakers via email or social media and really beg them to reopen nursing homes and long-term care facilities for support person visitation. You can learn more about that on our website, visitationsaveslives.com. Okay, Raquel Rivera, her sister is in a nursing home in San Francisco. I'd like to introduce you to the media.
Good morning. Thank you for inviting me to this meeting today. Again, I'm Raquel Rivera, and my sister Sandy is a patient in the subacute unit at Sutter CPMC's Davies campus in San Francisco. My sister Sandy is developmentally disabled. Prior to the shelter in place, we would visit regularly to bring her clean clothes, her favorite snacks and gifts. Our personal contact also allowed us to monitor her and make sure that she's not showing signs of an illness or other problem that may have been overlooked. We understand her body language and how she communicates, such as if she's not feeling well, in pain, angry, depressed, and when she's in a good mood. It is very abusive to a patient who is living in a long-term care facility that is not able to have personal visits with a family member, especially someone like my sister who cannot understand why we have not come to see her. She is being deprived of the comfort, care, and companionship that we provide during those in-person visits that are essential to her quality of life. The visitation ban has been very difficult on our family. It is heartbreaking, leaving us wondering whether her needs are being met because she may not be understood, that only we can express for her. During the pandemic, we were able to coordinate a virtual visit, but not all of us were able to participate because of the lack of remote resources the facility could provide. During the virtual visit, my sister Gloria noticed that Sandy's face appeared swollen and did not look well, and voiced her concerns to the nurse. A video call is difficult with Sandy because of her lack of communication that only an in-person visit can fulfill. We were unable to evaluate through the video call whether anything else was not right with her. 2 weeks later, Sandy was found unresponsive, and she's now in a vegetative state unrelated to COVID-19. My sister Gloria has been allowed temporary visits while Sandy remains in TICU, but once she is transferred back to subacute, she will no longer be allowed to visit. Visitation is absolutely vital for Sandy's well-being, especially in her current state. She needs stimulation in order to improve, which Gloria provides when she visits. She talks to her, plays her favorite music, and communicates with nursing staff if Sandy appears in discomfort or in pain. A revised policy needs to be implemented now that mandates all long-term care facilities to allow a designated support person visitation to see their loved one, following the same safety protocols and PPE as hospital staff. There is no difference between a nurse or anyone else who comes from the outside to wear the exact same gear as a nurse in order to see their loved ones. We need to return the quality of life to our loved ones. They should not have to suffer emotionally because they feel abandoned. Thank you.
Thank you, Raquel. I want to mention that at CANHR, we've received a lot of calls and emails from resident family members and also facility staff about how for people with cognitive disabilities, the virtual visits have been not only not comforting, but they've actually been triggering, where people get very frustrated with seeing their loved one on a screen, but not being able to really see them in person and throwing those devices across the room. or having a really bad emotional outburst. So virtual visits have not been much help to people, to residents with severe cognitive disabilities. Okay, I'd like to introduce Jay Cox. Her mother was in a nursing home in San Diego and unfortunately passed away recently.
My mother spent almost 3 full years in facility, and they told me at the very beginning that she would not be allowed to have physical therapy because she didn't meet the Medicare guidelines. So I began giving her physical therapy and every kind of therapy I could possibly give her. Every single night, except for Monday nights, I'd give her 1 day off. We would do arms, legs, and significant therapy, which improved her health dramatically. And she lasted for about 2.5 years, almost 3 years. On March 13th, Friday the 13th, I was told I was not allowed to come back after I just told her, Mama, I'll be back really soon. I had to turn around and say, Mama, they're not going to let me come back. And 25 days later, on April 7th, she died. She was on a video talk with me when I looked at her and she was going, and I realized later that she was probably aspirating at that moment. They had given her a nasal cannula and nobody had ever mentioned she was getting one. She was lying supine where she was supposed to be sitting up. And that resulted in silent seizures that ultimately took her life. A friend of ours from the facility who had been caring for his mom for 10 years, his mom was a Holocaust survivor, had to have her hospitalized and she was in critical condition very shortly after the isolation began. She'd been doing fine, and then she had to go to the hospital. They took over a gallon of infection off her right lung and over a liter of infection off of her left lung. And she recovered and then was subsequently put in a nursing home. And he was talking to her when he heard her alarms going off. And 2 days ago, she passed. And they plain flat told him that those were not her alarms, which they probably were, because 10 minutes later they called and told him that she had passed. And he was like, how could that have happened? I was just talking to her. There's another friend whose father has been hospitalized critically shortly after the isolation. Isolation prevents us family members from caring for our family members, particularly those like my mother and the Holocaust survivor who can't get out of bed, can't lift up their arm and wave it, can't speak and say, help me.
Yeah, there's just so much vulnerability out there right now. It's very concerning. I want to introduce Betty Nordwin, whose mother is in an assisted living facility in LA, and the assisted living facility's been very much in those solitary confinement conditions that I talked about earlier. Betty, you're on mute.
Hi, everyone. I'm Betty Nordwind. I'm also here with Robin Berkovitz, who's also available. Both of our parents are at an assisted living facility that's considered high-end in Beverly Hills. It's owned by Watermark Retirement Community. The owner is David Barnes. Tony couldn't have described it better, but all residents, including our parents, have been in solitary confinement since March. And Robin and I do not use this term lightly, since both of us have had extensive contact at the LA County jails. To describe what my mother's life has been since March, her only contact with human beings has been the delivery of meals and medication to her room by facility caregivers, amounting to 5 minutes approximately 5 times a day, and to be generous, an hour a day of human contact. In addition to 2 walks, which she does take and the facility allows, at all other times she's alone in her room, which is 450 square feet, including the bathroom. I once calculated that
if you take out her sleep, which I'm assuming is 8 hours, she's literally in the room by herself at least 12 hours a day. Watermark has stopped all family or significant other visits inside the facility in March and outside on March 15th. If there is any contact whatsoever with another human being outside of the facility, including a family member, the resident is quarantined for 14 days. That means they literally cannot go out of their room. So in my mother's case, she was prohibited from walking down the hallway to go to the laundry. Another example is she has a friend who's 100 who was outside of the facility, handed a photograph of her great-grandchild by the grandson, and they quarantined her for 14 days. Again, quarantine means you cannot physically leave your room to do anything. In addition to the total isolation, which has had the following observable behaviors in my mother's case. Lethargy, every time I call, she tells me she's sleeping. My brother and I, talking to her on the phone, can see memory loss and general confusion and general cognitive deterioration. I'm actually amazed at how fast this has happened. The person that I knew in February isn't the person that I knew now. In addition to total ban on personal contact and penalization if they do, in Watermark's case, they have not arranged or done anything to facilitate electronic visits. So the residents are on their own. The average age, I am told, is 85. Robin's dad is 96. My mother's 93. She can't use any electronic device without help from a staff member. They keep telling us there's no staff, and that's another issue. But so it's been an extraordinarily traumatic experience. I don't think Robin and I realized how widespread the problem was until we got involved with Tony and the organization. Thank you very much.
Thank you, Betty. Okay, so we're available now to answer any questions that you may have, clear up any concerns.
Hey, Tony, this is Mike Dark. Could you maybe address what kinds of measures facilities can take to help ensure that visitation can be safe?
Yeah, sure. So we've identified these in our support person visitation policy, but essentially we ask that the family member support person visitor be put through the same testing or screening that the staff members are put through, that they have their temperature checked, that they follow all the infection control protocols related to PPE, donning and doffing PPE, hand sanitizing, hand washing, and that they limit, really the support person visitor scenario is a much lower risk profile than it would be from the staff members, because they're only going to engage with their one family member in the safest possible context, which is outdoor preferably if the resident can do that and the facility has the space. But if it's indoor, then it's a one-on-one visit in a room that's isolated from any other residents, and that family member would have no contact with anybody else in the building, any direct contact. So that's it in a nutshell. If you have any questions, just unmute. You should be able to unmute yourself.
I'd just like to add that there are a number of facilities, particularly residential care facilities, that have facilitated outdoor visits, particularly in those areas of California that have nice weather, where they have a place, where they have a patio, where people can maintain even more than 6 foot distance, where they have masks, where they have PPE. We've had some family members saying that they've been able to have birthday parties for their grandfather or their father or mother. Other facilities say that they will always take a room, they wipe it, they're very careful to use all the PPE and the sanitation possible so that you never have more than just the visitor or the family visiting that person. Other facilities, I just got one email today when one woman said, I'll buy the PPE myself. I'll put on the full hazmat suit if necessary, but I want to see my mother. There are ways to do it if facilities cared enough. And we've been badgering the Department of Public Health and the Department of Social Services. And while they have put out new directives to allow some type of visitation, we're asking them, you have to mandate it, because if you don't do that, facilities are going to decide they have the discretion to do whatever they want. And that's a real issue.
I gather from all this that since I last wrote about this about a month ago with the help of Mike Dark and Mike Connors, I don't see any change. There's been no progress at all from the state or federal levels, or am I wrong about that?
Well, there was a new all facility letter issued by the California Department of Public Health on Friday. It's all facility letter 20-22.3. And it did take a pretty significant step forward in finally using the term shall with respect to visitation, that facilities shall permit visitation when the facilities have met certain criteria. And really the main criteria is no COVID positive residents or staff for at least 14 days. And if a facility has achieved a no COVID status for 14 days, they must allow outdoor visitation. And in some circumstances, they must allow indoor visitation. So this was a significant shift. Now, there's still lots of problems with that. The main problem is it only covers nursing homes and not assisted living facilities. But there's also some concerns about some of the terminology and defining how the criteria are satisfied. But this was an important step.
Has there been any visitation under that directive in the last few days since it was issued?
None that I'm aware of. And in fact, what I'm hearing from most of the family members that we've been talking to is that it's had no impact whatsoever at this point. A lot of facilities are saying that it doesn't apply to them. And I know in Raquel's situation, the nursing home is saying that they're governed by a local public health order that supersedes the state order. But in the best that I can find from San Francisco Public Health, the order related to nursing home visitation expired back in April.
Thank you very much.
I think that's one of the biggest problems. There's so many conflicting orders, all facilities letters, provider information notices from the Department of Social Services. There's nothing that's consistent and that mandates any kind of action on the part of the facilities. So the facilities say, well, we're going to decide what we're going to do. And each facility has the discretion pretty much to do whatever they want. And that's been one of the biggest problems. We have no consistency. It's much like the federal government. We have no consistency in provider information notices to assisted living facilities. I just found out on Friday from a notice that the department sent up that, in fact, none of the visitation or the testing or anything applies to continuing care retirement communities. And yet we have people in those facilities and those places, they pay enormous amounts of money to buy their condo. They pay enormous amounts of money to pay every month for the care, supposed care. They live independently, and they've been told, if you leave at all, you're going to have to be subject to 14 days quarantine. So the department sends out this notice saying, by the way, this doesn't even apply to CCRCs. And I said, well, that would be really nice if you'd let the CCRC providers know that. So then we could let the residents know that. And I think that's one of the biggest problems. The residents aren't informed, the family members aren't informed of what are the guidelines.
Tony, there are a couple of questions in the chat that have been waiting, so if you can have a look there.
Yeah, the first one is about CDPH responding to our advocacy, and I think the all facility letter is, the latest one is sort of the best answer for that. I think to some extent the Department of Public Health is listening to us, albeit we asked for this back in early May, the concept of support person visitation. But again, we were happy to see that there were some mandates in the latest guidance rather than just permissive language, allowing facilities to sort of decide for themselves. There's also this question about liability for bringing COVID in. Under our plan, would family members accept responsibility for the risk they pose or not? I'll tell you that there's nobody who's more concerned about the welfare of the residents than their family members. So the idea that I don't think there's any family members who would be visiting without extreme precautions and taking and accepting the most stringent conditions on their visits. I don't think there's any family members who are going to be opposed to these ideas that there's conditions on their visitation to ensure the safety of their loved one and all the residents in the facility. In terms of liability, I think it's just a common sense rule. The Department of Public Health has outlined some very good, we think very good criteria for the situations where they'll be required to bring visitors in, and they're going to have to abide by them. And they're reasonable, and as long as they abide by those rules, then I don't see any additional liability on their part. If COVID-19 happens to come in despite the very best efforts that we could possibly provide, then I don't see how liability would be an issue for them. Yeah, hi Jay, did you want to, let me try to unmute you there.
I absolutely do. I want to echo that the importance of mandating. Mandating is so important. I have friends who, well, the one who just lost his mother, who would have been in there as soon as possible if it had been mandated, and the people had absolutely no choice but to allow him to come in. He wanted to come in and care for his mother. By looking, he could tell what was the matter. And the gal whose father is still there and still alive, she would do anything to come in. Whereas your workers have a certain level of complacency and compassion fatigue. Compassion fatigue permeates nursing homes and facilities. I also want to mention that my mother wasn't in a, quote, nursing home, unquote. She was in a rehab facility that has long-term care patients. And the people who were trying to get in to see their family members were told that they have to let them in only as medically necessary. And medically necessary can be defined by the facility as to not include the family member who is actually more medically necessary than the CNAs, the nurses, and the doctors, because the family member knows that patient better. And who but the family member is the one least likely to have that compassion fatigue, least likely to be complacent. I also just want to say that the recent allowances, the fact that they are insisting that they shall is huge, but they need, that verbiage needs to contain words like mandated, because then they will feel as though they have to comply or suffer the consequences.
Yeah, Lori, there's a question for you in the chat. Did you see that? It's about what you're calling for on a national basis. Could you address that, please?
Yeah, absolutely. The same as CANHR is, we are also calling for the federal and state governments to permit every resident to designate an essential support visitor who is going to be permitted to visit on site following the same screening and infection protocols as staff. We think that every resident should be entitled to have a support person dedicated to them, and that they should be given access to that person in a person-centered way. We also think that there need to be reasonable accommodations for visitation, including ample visitation hours and privacy for residents and visitors, since that's also something that's left very much up to the discretion of facilities. The support people and the protocols that are established need to be developed in a way that is person-centered, so that it really is looking at meeting the needs of the residents, what their specific needs are, so not being arbitrarily put into place. We're seeing some examples of visitation, including for compassionate care, such as even at end of life, where family members are being given one visit to see their family member at the end of their life. And so the families are having to make very difficult decisions about when is it I'm going to go in and see my family member for the very last time. And that is really unconscionable. So we think that any protocols that are put into place or policies should be taking into account the needs of the residents and how the families can best support them during this process.
You know, I'll mention that the visitation issue has been described as like walking a tightrope, and I think that's absolutely true. The problem with the government's approach is it's been very clunky. And Lori mentions person-centered. The details of how we make visitation work and we walk this tightrope, I think are very difficult. And I think some of that difficulty has discouraged policymakers from really rolling up their sleeves and creating detailed policy that will try to strike a better balance. Instead, we have this very hurried, too broad policy that really leaves a lot out here. And I think the missing element is the consultation with residents and their family members themselves, bringing them in to the process of policy making so their interests can be addressed.
So, Tony, this is Betty.
Yeah.
Okay, so what about, just picking up on what you said, what about having, and is this feasible, the legislature have a work on some much more refined policies or something like that, something that's, much more thoughtful because this is long term, with a quick turnaround, let's say 2 months or something, rather than just relying on administrative agency, work.
Yeah, I agree. But on this issue, the legislature has not been interested in picking up anything, and that's unfortunate.
Got it.
I think one of the biggest problems is that even among relatives, we've had emails from relatives saying, well, I don't want to go visit my mother. I don't want to, we don't have any COVID in our facility, and I'm very concerned if you open up facilities. And I think that's one of the problems, is that people think that we're calling just to open them up and let visitors come willy-nilly into facilities, and that's certainly not true. The idea that you could have nursing staff go in and out, go home, not that most of these facilities didn't have appropriate PPE in the first place. A lot of them still don't. A lot of them still have major problems with staff not washing their hands or not using gloves. And what we're saying is that essential family members or essential visitors will take every possible precaution. You could have mandates. You could have people set up appointments. You could have a separate outdoor area where you could have people maintain the social distancing. You can, require people. Nobody comes in this facility unless they have a mask on. Nobody comes in unless they have gloves on. Nobody comes in unless we do the kind of testing for thermometer checks. All the kinds of things that they should be doing for the staff that's going in and out of those facilities. And that's basically what we're asking. We're saying it's, the essential visitors, the family members, are in many cases even more important than having the facility staff.
Yeah, and that's very much missed in this discussion. We have another question from the chat about discussing more about how barring visitors has not had a positive impact on reducing spread. And I hope that's not the point that you've heard me make. I think the barring of visitation absolutely, at some level, reduce spread somewhere. But that's really not the issue for us. The issue is balancing the impact of the loss of visitation in terms of the cost versus the benefits. And I think on that, the balance has been way off. Prohibiting all visitors creates massive harm in terms of isolation and unmet needs in nursing homes. It likely did reduce the spread at some level, but now with the measures that we're talking about that all apply to the staff applying over to a support person visitor, we don't think that there's in any way a substantial risk of increased COVID exposure. But we would be picking up all of these residents who are getting visitors now, would no longer be isolated, who would no longer have care deficiencies, and who would now have a set of eyes and ears in the facility to point out problems. to other family members or policymakers and get them addressed sooner rather than having facilities collapse, which we've seen a few times very recently.
I think it's clear as we even talk about the need for the families to be coming in, and this has been mentioned a few times, but when you look at the impact on the residents who are experiencing great distress because of either loneliness or lack of connection with their family members, who literally are giving up the will to live. And that's not something I say lightly. Those are exact words that have been shared with us by family members and ombudsman programs and advocates across the country. Residents who aren't being fed, or who need help with drinking or with getting out of bed, who might not be getting the staff supports they need because of the critical lack of staff that are available and the supports that the family members have been giving to them. I think that all of those things play into why it's so critical for the families to be allowed in. And while it is the responsibility of the nursing homes to be providing all of these services, we don't discount that they should be held accountable for that. The fact of the matter is, in many cases, it's not happening, and we should not be turning a blind eye to that, and it is necessary that families be allowed back in to help.
We have a question about testing. Should testing be mandated in nursing homes and assisted living for staff? This is something that California Advocates for Nursing Home Reform has called for in our action plan for the state related to COVID-19, that all facilities should have all their residents and staff tested, baseline testing, and then some sort of updated testing on a weekly or bi-weekly basis to make sure that so we can identify COVID-19 hotspots. And then the question is, should visitors be required to be tested? And I'll tell you that all the many family member visitors that we've talked to, they would be glad to take a COVID-19 test if it meant that their negative status would get them a ticket into the building or outside of the building to see their loved one in person.
Yeah, if that testing was available. You know, supposedly they're requiring testing of all nursing home residents in LA. How about 40% have been tested? You know, you can require it, but we don't have the testing available in California or anywhere else in the country, regardless of what the federal government says. It's simply not available. But family members would be happy to.
Yeah, the lead up to the question says testing is a mess in California, and with that, we absolutely agree.
Yeah, that's very true. I have to say, well, I know a couple of RCFE operators, and one said that she's set it up on the patio outside because she's in an area where it's warm outside and there's not a lot of wind and it's protected. She makes sure that there's 6 foot distancing. She makes sure that everybody wears masks, that everything is sanitized and all of that. But because one resident in her facility said, just like Lori said, he said, what's the point of living? If I can't see my family, if I can't see my grandkids, if I can't see my, relatives, what's the point of living? And it has been, over 3 months now? This is terrible. What we're doing is we're increasing the morbidity and mortality rates of residents in nursing homes and in residential care facilities. And we can talk about all these safe precautions they're taking regarding COVID, but that's one thing that we really need to press for. We need to allow at least a designated visitor. We need to allow for outside family visits. We need to do the kinds of things that just make good sense.
Tony and Pat, this is Betty again. Your statement just reminded me, a voice that's been really not heard from is the geriatric medical community. And it's hard for me to believe that they do not support what you're talking about. I did hear this Dr. Wasserman from Jewish Home for the Aging. So I would think that they're allies, because this is, for geriatric people, this is the worst possible thing you could do to an older person. So why haven't we heard more, and why aren't the journalists interviewing them Why aren't they part of this conversation?
Well, they are, and Tony and Laura, you can speak more to that, but I've seen a number of comments by geriatricians and by medical directors and by others who echo the same sentiments, right?
Yeah, and I actually had an email with Dr. Wasserman this morning about joining his group that's talking about visitation in long-term care facilities. So I know that they're thinking about this policy, and the providers I've spoken to are absolutely supportive of the idea of allowing visitors in a very limited way to come back and visit with their loved ones. They're telling us that, I mean, they're as concerned as anybody that their residents are dying because of the massive loss they've suffered as a result of the visitation ban. And they're so hopeful that the policymakers will turn this thing around before we lost too many people.
Right. Well, I guess I'm just being the sister of a journalist, a former editor. I'm just wondering why the media isn't covering the geriatrics. You know, UCLA, for instance, has a very fine, and I would just hope that they would talk because, you know, from a geriatric point of view, this is just really terrible. And I do think also the modeling of facilities that have done it successfully is really important because it creates the press. You know, you can look and say, you know, because that, you know, it's possible to do it, because one of the things that has stopped conversations with me is people seem to say that I'm suggesting I expose my mother to COVID everywhere, as opposed to saying, no, there are safe ways to do this, particularly since, as you said, they're in LA, there's, you know, weather is a help factor. So I think using examples of successful things, getting into the media, geriatrics people, is really, really important.
Yeah, I agree.
Can I interject something here?
Sure. Yes,
I'd
please.
like to say a couple of things. One thing is that my mother was on hospice and I was supposed to be notified if she was getting close, but it wasn't in time. They told me after she'd passed. I was only 8 minutes away. I was not allowed to come and be with her until after she had passed. Then they allowed me a few minutes with her. I can honestly and obviously say the same thing for my friend. I'd also like to point out that since my mother wasn't eligible for exercise, I did the exercise. And since the facility wasn't taking good care of making sure that her room was antiseptic in times when there were things that were contagious, I did. I studied. I found out that you can't prevent pneumonia using hydrogen peroxide, but you can prevent it using bleach water. And I went in with my gloves and my bleach water and I washed it down. And I prevented her from getting pneumonia that way. I'm going to say that there are a lot of things that family members are doing for their family members because they realize that the facility either doesn't have the manpower or doesn't care to. When it's your mother, you have a very different outlook than when it's one of your 100 patients. You have a very different outlook. Those of us who have a family member in there, we know that expression. Look, this is my mother. It's not their mother. I like to just point that out. Yes, we are very, very conscious of our ability to go in and visit our family member and not infect them. And we are probably 100 times more cautious about that issue because this is my mother.
Thank you. So we're coming up close to the end of the hour. Are there any more questions? Or I'm wondering, Raquel, is there anything else you would like to say?
No, I think June and Betty really covered the same concerns and precautions that we have as well. So,
Okay. All right.
thank you.
So I don't believe there's any more questions. Of course, if there are any additional questions, you can reach me or Lori or Pat. And I can, if you want to, I can connect you to the family members that have spoken today. My email address is Tony, Tony, at canhr.org, CANHR.org. I want to thank you, all of our speakers, for being here today, and all of the media for your interest in this issue. Thank you very much.
Thanks so much.
Thank you all. And please
Thank
let
you
us know if
too.
you have any questions.
Thank you for what you're doing. People's lives depend on it. Thank you.
Thank you for speaking out.
Yes, thank you.
Thank you
Bye.
so much.
Thank you.